For years, a Singapore woman treated her neck, shoulder, and back pain without knowing what was causing it. The answer, she later discovered, was the physical weight she had been carrying since her teenage years. Rebecca Ng is 38. Her bra size increased rapidly from AB cup to AD cup while she was in secondary school. The physical change also brought unwanted attention. Classmates called her names, and she learned to laugh along because she feared that protesting would make the teasing worse. But the problem went far beyond hurtful comments. Running and high-impact sports became uncomfortable after becoming a mother and breastfeeding. Her size increased further to a 36E. She eventually stopped taking part in activities that caused discomfort. When chronic pain developed in her neck, shoulders, and back, Rebecca did not immediately connect it to her chest. She sought relief through traditional Chinese medicine instead. Only after searching her symptoms online did she realize that breast size could be contributing to the pain. Diet and exercise did not solve the problem. After her second child finished breastfeeding in 2024, she also noticed significant sagging. Rebecca then consulted plastic surgeon Dr. Li Hanjing at Mount Alvernia Hospital. After examining her, the doctor concluded that a substantial reduction could help relieve the long-term physical strain. Rebecca underwent surgery in December 2024. Around 700 to 800 grams of tissue was removed in total. Her size went from 36E to 34C. Because her procedure was considered medically necessary, insurance covered most of her expenses. However, that does not mean every similar procedure will automatically receive coverage. Each patient's condition and insurance policy may be assessed differently. Recovery was not effortless. The first 2 weeks were uncomfortable. She had to manage tight surgical clothing, awkward dressings, and itchy scars. Still, she said the physical relief was noticeable almost immediately. By the first month, clothes fitted better and daily movement became easier. She later returned to running and took up activities such as golf, Pilates, and Taekwondo. Here is the part that deserves more attention. Breast reduction is often viewed mainly as a cosmetic choice. But in Rebecca's case, it was carried out to address chronic pain and restrictions on everyday life. Her doctor said some women in Singapore may quietly manage similar discomfort with supportive undergarments or lifestyle changes instead of seeking a specialist assessment. Local data is limited because many people may not recognize their discomfort as a medical issue or may feel embarrassed discussing it. That creates an important distinction. Nobody should feel pressured into having surgery, and an online story cannot determine what treatment is suitable for another person. But persistent pain should not be dismissed simply because its possible cause involves a sensitive part of the body. Rebecca said her only regret was not acting sooner. Do you think breast reduction is still too often judged as a beauty procedure rather than a possible treatment for genuine physical problems? Share your view below and support 2230 by liking this video, sharing it, and subscribing for more trusted explainers.